Hi, fellow future RNs. Today, let's talk about the warning signs of cancer and its grading and staging system. When it comes to cancer, early detection and early diagnosis can mean so much. It can increase the chances of our patients for successful treatment as well as increase their chances of survival. There are a number of methods and tests that we can do to facilitate early detection of cancer. For example, the mammography to detect breast cancer. We also have your pap smear test for the detection of cervical cancer. Very important, breast self-examination and testicular self-examination for early detection of breast cancer and testicular cancer. And of course, the routine assessment of warning signs of cancer na siya namang pag-uusapan natin today. For the warning signs of cancer, ang ating mnemonic is caution us. C is for changes or change in bowel or bladder habits. A is for any sore that does not heal. Pwede rin itong sign ng nag-start na skin cancer. U is for unusual bleeding or discharge. T is for thickening of her lump in breast or elsewhere. I is for indigestion. O is for obvious change in wart or mole. N is for nagging cough or hoarseness. Pwede sa cancer of the throat or lung cancer. Unexplained anemia. And S is for sudden weight loss. If you have any of these warning signs of cancer, it is important to consult a doctor as early as possible. Now let's talk about the grading and staging. So itong grading and staging, these are methods to describe the extent of the tumor, the extent to which malignancy has increased in size, the involvement of regional nodes, and metastatic development. Grading a tumor classifies the cellular aspects of the cancer through microscopic evaluation of the level of differentiation in the cells. This is an indicator of the tumor growth rate and spread. Staging naman classifies the severity and clinical aspects of the cancer and degree of metastasis at diagnosis. May mga methods na ginagamit ang mga doctors when it comes to grading and staging tumors or cancers. Nagda-diagnose, ang nag-grade, ang nagsistage, nagbibigay ng grade and stage doon sa cancer are doctors. But as future nurses, we should also be knowledgeable about this para we know how to educate our patients and also para ma-anticipate natin yung needs ng ating patients and ng doctors as well. Sa grading, usually ito naririnig natin, grade 1, grade 2, grade 3, and grade 4. Grade 1, cells differ slightly from normal cells, well differentiated, or meron ng mild dysplasia. When you say dysplasia, it is the presence of cells of an abnormal type within a tissue. So, hindi siya yung normal cells natin. Okay? Kapag grade 2, the cells are more abnormal and are moderately differentiated. So, meron ng moderate dysplasia. Kapag grade 3, severe ang dysplasia. And kapag grade 4, cells are immature and undifferentiated. When it comes to staging, we have stage 0, stage 1, 2, 3, and stage 4. Stage 0, carcinoma in situ. So, ang ibig sabihin nito is, ang cancer is confined lang siya doon sa original place kung saan siya nag-umpisa na mag-grow. Okay, meaning the cancer has not grown nor spread to other areas of the body. Stage 1, think about localized. Kasi kapag stage 1, yung tumor natin is limited to the tissue of origin. So, meron siyang localized tumor growth. The size of the cancer is small, showing no signs of spread to other areas of the body. Kapag stage 2, there's limited local spread. Okay, the cancer has grown in size but without any spread to surrounding tissues. So, hindi pa siya kumakalat sa stage 2 sa mga surrounding tissues. But kapag stage 3 na ang cancer, there's an extensive local and regional spread. Okay, so stage 3, think of regional. The size of the cancer is big and has spread to nearby lymph nodes, tissues, and organs. So meron na siyang local and regional spread. Kapag naman stage 4 na, meron na tayong distant metastasis. Ibig sabihin, ang cancer ay kumalat na doon sa mga areas away from the primary tumor or away kung saan siya nag-umpisang tumubo. For example, meron ang ating pasyente merong lung cancer. Tapos yung cancer na yon nag-metastasize na, meron na rin sa liver. Okay, so yun na yung mga distant metastasis. Kumalat na siya sa ibang parte pa ng katawan. Another cancer staging system na widely used by doctors is the TNM staging. Okay, so ano ba to? Okay, T is for tumor. Kung gaano nakalaki yung primary tumor and kung nag-spread na ba ito sa mga surrounding tissues. Okay, N is for lymph nodes or nodal involvement. This is to determine the spread of cancer to the lymph nodes. Remember na ang lymph nodes natin, nag-a-act yan as filter when the tissue fluids enter the lymphatic capillaries. And M is for metastasis. Kapag sinabi nating metastasis, ito yung pag-spread ng tumor or ng cancer beyond your regional lymph nodes. Kaya kumakalat na siya sa iba pang parte ng ating katawan. So, ito hindi naman natin kailangang i-memorize, no? Kailangan lang natin maging familiar, lalo na doon sa mga important. Kapag kasi nag-diagnose yung ating mga doctors, no, ang nilalagay nila usually, ito na lang, itong letters and numbers. Kaya it would help if we are familiar to this. At least makikita natin, may idea tayo kung anong stage na yung cancer ng ating patient. Unahin natin yung mga madaling tandaan. Okay, kapag may nakita kang X sa tabi ng T and M, kahit alin dyan sa kanila, so TX, NX, or MX, ang ibig sabihin yan is unable to assess. Okay? So, kung TX siya, unable to assess the primary tumor. Kung ang X ay katabi ng iyong N, ibig sabihin, unable to assess yung lymph node involvement. Kapag naman sa metastasis, unable to assess distant metastasis. Kapag naman 0 yung katabi ng ating letters, ibig sabihin yan ay no. Okay, so kapag sa tumor, there is no evidence of primary lesions. Kapag sa lymph node, there is no lymph node involvement. At kapag sa metastasis, there is no distant metastasis. Again, kapag X, unable to assess. Kapag 0, no. Another thing also na kailangan mong tandaan kapag makita mo ang TIS or TIS, ibig sabihin yan ay carcinoma in situ. Kasi ang IS dyan is in situ. Na nabanggit na natin kanina, no, ang ibig sabihin ay yung cancer ay confined lang doon sa area kung saan siya nag-umpisang tumubo. Okay? So after nyan, meron ka ng mga numbers. Sa tumor, you have T1 to T4. Sa lymph node, you have N1 and N2, and sa metastasis, M1. Ibig sabihin, there is distant metastasis. Kapag naman sa lymph node, ang kaibahan ni N1 at N2 is kapag N2 na, meron ng metastasis to 4 or more lymph nodes. And kapag T4 na yung sa tumor, ibig sabihin, ang tumor ay nag-penetrate na deep into the peritoneum or other organs. Again, ang nagde-diagnose nito, ang gumagawa nito ay doctors, cancer specialists, pero makakatulong to sa atin bilang future nurses para alam natin paano tutulungan, paano i-educate ang ating mga pasyente, at paano natin ma-anticipate yung mga needs also ng ating doctors and healthcare providers. Don't forget your warning signs of cancer. Again, the mnemonic is caution us. And remember that there are various diagnostic tests that can be performed, no, depending on the suspected primary or metastatic site of the cancer. But remember na ang most definitive means of diagnosing cancer is through biopsy. That's all for today, fellow future RNs. Thank you. Bye.